Good morning, everybody, and welcome. My name is Ron Johnson, and I'm Eastern Health's Vice President for Information Services and Rural Health. It's my sincere pleasure to be your MC today at Eastern Health's annual general meeting. Before we begin, I'll start with a land acknowledgement. We respectfully acknowledge the province of Newfoundland and Labrador, of which the city of St. John's is the capital city, as the ancestral homelands of the Biotic. Today, these lands are home to a diverse population of Indigenous and other peoples. We would also like to acknowledge with respect the diverse histories and cultures of the Mi'kmaq, the Innu, the Inuit, the Nunatuckavut, all of this province. Welcome to Eastern Health's annual general meeting, which we're holding virtually this year due to the COVID-19 pandemic and physical distancing requirements across the country. Joining us today are Mr. Leslie O'Reilly, Chair of Eastern Health's Board of Trustees, Mr. David Diamond, President and CEO of Eastern Health, Ms. Sharon Forsey, Trustee representing the Finance Committee of the Board, and Ms. Heather Hanrahan, Deputy Minister of Regional Services with the Provincial Department of Health and Community Services. I want to thank everyone for joining us online this year. In a few minutes, our board chair will address the various people that have joined us today. But first, I would like to ask Ms. Hanrahan to say a few words on behalf of the Department of Health and Community Services and the provincial government.
Thank you, Ron. I'm delighted to be here today to bring greetings on behalf of the Minister of Health and Community Services. It is a great opportunity to reflect on the past year and Eastern Health's many accomplishments. While our department sets the overall strategic directions and priorities for the health system, it is the role of the regional health authorities to deliver and administer health services. We acknowledge Eastern Health has some unique challenges, being the largest health authority in the province, in addition to providing full continuum of care to the residents in the Eastern region. Eastern Health also is the provider of many specialty services and tertiary care to the entire province. I would like to take a couple of minutes to acknowledge some of Eastern Health's accomplishments over the past year. During the 1920 fiscal year, Eastern Health reduced wait times for cardiac patients waiting for cardiac catheterization. Not only did Eastern Health increase patient flow and decrease overtime costs, it improved access to inpatient beds, which impacts many aspects of acute care, including wait time of patients in the emergency department awaiting admission, as well as ability to perform surgeries. On a personal note, I'd like to say when I joined the Regional Services branch 4 years ago, this was probably our area of greatest public complaint. And in the last 6 months, I'm not sure we've had a complaint in this area, so I'll knock on wood on that one. Also this year, Eastern Health's paramedic group introduced a new computer-aided dispatch and mobile dispatch system to improve access to patient care. And research shows that timely access to paramedic services is integral to patient outcomes. I'm looking forward to a presentation of this new system in the department in the next couple of weeks. Population health is a priority area for the department, so we are pleased that Eastern Health has made improvement this past year to gather and share information about population health and wellness with Eastern Health's Community Health Survey. As well, the new information section on your website has helped many individuals obtain information about healthy living and different life stages. I also commend the staff at the GB Cross Hospital in Clarenville for being one of the first healthcare organizations in Canada to perform innovative technique for the surgery treatment of breast cancer that doesn't require nuclear medicine support. It is wonderful to see the introduction of this less invasive procedure in a rural site. Finally, this year, Eastern Health received a license from the Canadian Nuclear Safety Commission to begin commissioning of the cyclotron for medical imaging facility at the Health Science Complex. The cyclotron will enable the production of medical isotopes on site, which are needed to operate the PET and CAT scanner and reduce risks associated with transporting medical isotopes to the province. Producing the isotopes on site will make the service even more seamless, which is particularly important at this time of low volume air traffic in the country. Such initiatives over the past year demonstrate a culture of healthcare innovation and evidence-based decision-making. In addition to these new initiatives, I acknowledge many of the success in Eastern Health's 5 priority areas: access, quality and safety, population health, health workplace, and sustainability, such as reducing emissions associated with ambulatory care sensitive conditions, increasing breastfeeding initiation rates, reduce no-show rates for appointments in select areas, and increasing engagement of client and family advisors who are so crucial to understand the perspective of healthcare consumers. The department supports Eastern Health's goal to strengthen the home-first approach to healthcare with an increased focus on caring for individuals in the community as opposed to acute or institutional-based care. While there have been numerous successes, before I close, I must acknowledge some of the unique challenges brought to us in 2020, including, and almost forgotten now, I think, the record-breaking blizzard in January 2020. The commitment of your staff to ensure that health services continued was commendable and showed the true dedication of all healthcare providers. And of course, starting late in this fiscal year, we continue to manage the impact of COVID-19 pandemic. The hard work, dedication, and cooperation of the frontline staff and management of the 4 health authorities to respond to COVID-19 has been extraordinary. We have come together as a provincial health system to protect our public as never before. On behalf of the department, I thank Eastern Health managers, physicians, and all staff for their ongoing work under these challenging circumstances. Through this work, I feel confident that we will continue to safely manage this pandemic. Our department is appreciative of the great relationship with Eastern Health. We look forward to continuing to work with Eastern Health towards your vision, healthy people, healthy communities. On behalf of Minister Haggie, I would like to wish you a successful AGM and all the best in the upcoming year. Thank you.
Thank you, Heather, for those remarks on the behalf of the Department of Health and Community Services. And now invite our board chair, Mr. Leslie O'Reilly, to speak.
Good morning. It is my sincere pleasure to participate once again in this year's annual general meeting. As you all know, this has been an extraordinary year of significant challenges as a result of the weather-related events in January and the COVID-19 pandemic. However, out of these challenges, we also experienced some meaningful opportunities. There is a famous saying that necessity is the mother of invention. Out of ingenuity, a willingness to find quick solutions, and an ability to think outside the box, Eastern Health came up with new, innovative ways to offer health services safely to those who need our care most. I warmly welcome Eastern Health's employees, physicians, and volunteers. On behalf of the entire board, I'd like to extend my gratitude to all of you for the amazing contributions you have made over the past year and for your unwavering dedication, professionalism, and resilience throughout these unprecedented times. Next, I would like to thank our health foundations and auxiliaries for their acts of kindness and giving within our communities, which have had a tremendous positive impact on our patients, families, and the entire organization, never more so than this year. Board of Trustees, I would like to recognize all of you for the work for joining in on this live broadcast today, some of whom are quite new to the board, while others have served for a longer time. All of you have provided valuable input based on your backgrounds and experiences and have been wonderful ambassadors for various communities throughout the region. Thank you for all your guidance, passion, leadership, and devotion that you bring to your volunteer governance role. And to members of the Eastern Health's executive team, thank you for your commitment to ensuring our patients and families across the province are receiving quality healthcare services. Your leadership has been invaluable during the implementation of extensive operational challenges and the ongoing recovery planning related to events of the past year. Last but not least, I welcome members of the public, community partners, and members of the media who have joined us online today. As many of you are aware, Eastern Health's Regional Authority is Newfoundland and Labrador's largest regional integrated health authority, providing a full continuum of health and community services, including public health, long-term care, and acute or hospital care. Approximately 313,000 individuals reside in the Eastern Health region, which spans the entire Burin, Bonavista, and Avalon peninsulas. In addition to this, Eastern Health is also responsible for delivering tertiary level programs to people across the province and services to the people of Saint Pierre and Miquelon, expanding our reach to approximately 527,000 people. Now we will move on to the next order of business, the approval of the 2018-19 fiscal year AGM minutes. At this time, I am seeking approval for the minutes of the 2018-19 AGM held on September 26, 2019 at the Clarenville Inn. I would ask the movers and seconders to turn on the cameras, Marilyn Thompson and Jim Miller.
Yes, so moved. I move the acceptance of the minutes as written.
Second it.
Thanks, Marilyn and Jim. It's been moved and seconded. All those in favor? Contrary-minded, motion is carried. Thank you. Next, I would like to share a few important highlights and partnerships from the past fiscal year. In June 2019, Eastern Health announced the outcomes of new initiatives to improve workflow and scheduling at the Provincial Cardiac Cath Lab at the Health Science Centre. Areas for improvement were identified with the help of clinical process improvement experts. Following these changes, Eastern Health saw significant reductions in wait times for catheterization and reductions in lengths of stay for cardiac patients across the province, resulting in cost savings and greater bed availability at hospitals. The initiative also resulted in reduced overtime expenses at the cath lab. This past fiscal year also saw Eastern Health become the first regional health authority in the province to implement the Inetcad computer-aided dispatch system for Eastern Health hospital-based ambulances. This system identifies which available ambulance is closest to an emergency, thereby facilitating faster responses to 911 calls. Eastern Health uses an extension of this system, which provides responding paramedics with detailed call information and real-time updates on a mobile device, thereby increasing patient privacy by reducing the amount of information provided via radio or cell phone. Access to this system was made possible through a generous donation from the Healthcare Foundation. During the past fiscal year, patient care was also improved by the offering of a new innovative technique for optimal surgical treatment of patients with the early stage breast cancer at the WGB Cross Hospital in Clarenville. And that was, of course, just acknowledged by the department. Very appreciative of that. Eastern Health was the first healthcare organization to perform this practice, which is less invasive than alternatives and significantly reduces potential side effects. And of course, we want to thank the generous support of the Discovery Healthcare Foundation and the Dr. H. Bliss Murphy Cancer Care Foundation as well. I would be remiss if I did not acknowledge the outstanding contributions provided through our other foundations, the Janeway Foundation, the Burin Peninsula Healthcare Foundation, and the Trinity Conception Placentia Health Foundation. Their support over the last year and beyond has been invaluable to our patients, clients, and residents. Thank you very much for all our foundations, for all the work that you do. We really appreciate it. I'm also excited to talk about some of Eastern Health's most recent initiatives to gather information and share information about health and wellness. In April 2019, Eastern Health launched a community health survey as part of its community health assessment, an ongoing process undertaken to understand the health, strengths, and needs of our population. Respondents identified addictions, mental health, cost of living, and chronic disease as the areas that they were most concerned about in their communities. Eastern Health is currently investigating regional differences in reported accessibility of healthcare, and a very important item, satisfaction with healthcare services, and community health and wellness, population health we refer to it, to understand how it can best serve communities across the Eastern Health region. Eastern Health also launched a new health information section known as HI on its website. The website contains information on over 200 health and wellness topics, along with links to resources and community agencies. HI was launched as part of a larger website redevelopment project which aims to improve the quality and accessibility of online information about Eastern Health. Input from client and family advisors and frontline providers has been an invaluable part of the ongoing development process. If you would like to access HI, please visit hi.easternhealth.ca. Lastly, but importantly, I would like to tell you about Eastern Health's innovation strategy, which is helping to encourage a culture of innovation throughout the organization. The strategy identifies Eastern Health as a living lab, an environment in which to develop and test innovative healthcare solutions and products in real situations. The innovation strategy aims to improve Eastern Health services and programs, maximize health systems efficiencies and minimize associated costs, and generate economic development and employment opportunities in the province. The $1.7 million living lab is cost shared between the Government of Canada through ACOA, the Government of Newfoundland and Labrador, Eastern Health, and 10 strategic innovation vendors. Additionally, Eastern Health has partnered with the other regional health authorities, the Newfoundland and Labrador Center for Health Information, the Newfoundland and Labrador Association of Technology Industries, post-secondary institutions, and others in this endeavor. Eastern Health's investment in innovation has been instrumental in its response to the COVID-19 pandemic. Many innovative solutions have been developed and implemented rapidly to enable the organization to continue to provide safe and exceptional care, equip employees with necessary resources and supports, and maintain connections between patients, residents, and their families. This year has been a different year for healthcare organizations, as Heather mentions, all across the world. There have been many challenges and many opportunities. I would like to assure all those depending on us for their health care that we are working hard to ensure you receive the quality health care that you are used to. We have worked diligently on a resumption plan for our patients and I am pleased that we have now reached 90 to 100% resumption of services in just about all areas. In order to achieve resumption in services, we had to balance the need to maintain precautions put in place to keep patients, visitors, and staff safe throughout the pandemic. This includes the ability to physical distance, personal protective equipment use, bed occupancy, availability of drugs and supplies, pre-procedure swabbing, additional cleaning protocols between patient visits, and the many new measures added to our normal workflow processes to ensure patient and staff safety. Our top priority is, and continues to be, delivering safe patient care during the COVID-19 public health emergency. We acknowledge that this has been a difficult time for those awaiting routine procedures, and we thank you for your understanding during this unprecedented time. I know that staff have been working diligently to provide the safe, high-quality patient care that Eastern Health is known for. So on behalf of the patients, residents, and clients of Eastern Health, I sincerely thank you all on behalf of the board. Thank you to everyone who has taken the time today to participate. We greatly value your interest.
Body report from the Finance Committee.
Thank you, Ron. Good morning, everyone. Mr. O'Reilly, Mr. Diamond, Ms. Hanrahan, fellow board members, invited guests and staff, I'm pleased to present for adoption at this annual general meeting the financial statements for the Eastern Regional Health Authority for the fiscal year ended March 31st, 2020. These financial statements have been audited by the firm of Ernst & Young LLP, and I am pleased to report that the auditors have expressed an unqualified opinion on these statements. Eastern Health has 12,750 employees and 714 physicians, of which 280 are salaried. And Les has already expressed our thanks to their efforts during the past year. For the fiscal year 2019-2020, Eastern Health's cash-based operating expenses were $1.612 billion, of which 78%, approximately $1.26 billion, were spent on direct patient care. The other areas of expenditure included support, administration, research, and education. A detailed breakdown of Eastern Health's finances can be found in the operating revenue and expenditures section of our annual report. During the fiscal year 2019-2020, Eastern Health incurred an operating cash deficit of $88 million, while a year-end accrued deficit of $36.5 million was realized. The reduction in deficit from cash to accrual is primarily due to the reduction of severance liability associated with collective agreement terms and conditions, and can be found in Schedule 2 of the financial statements. The financial statements are included in the annual performance report, which is available at Eastern Health's website at www.easternhealth.ca/APR. I would like to take this opportunity to thank the members of the Finance Committee and the Board of Trustees for their support and commitment during the year in overseeing the finances of Eastern Health, as well as to the President and CEO, his executive and staff for their work and dedication. Mr. O'Reilly, I move the adoption of the audited financial statements for the Eastern Regional Health Authority for fiscal year ended March 31st, 2020. May I have a seconder?
It's Scott Messier, I'll second.
Thank you, Scott.
It's been moved and seconded that the financial report for this year be accepted. All those in favor? Contrary-minded? Motion carried.
Mr. O'Reilly, my second duty this morning is to move the appointment of the authority's auditors. I move the appointment of the firm Ernst & Young LLP as auditors of the Eastern Regional Health Authority for the fiscal year ended March 31st, 2021.
Been
May I have a
moved.
seconder?
Carol,
Yes, I'm happy to second. Thank you.
been
Thank
moved and seconded that the auditors, outlined in the motion, be approved. All those in favor?
Aye.
Contrary minded? Motion is carried.
Thank you. And back to you, Ron.
Thank you, Sharon, for your dedication and leadership. I now invite our President and CEO, Mr. Dave Diamond, to speak about Eastern Health's performance related to our strategic priorities for fiscal year 1920.
Thank you very much, Ron, and good morning, everyone. Our previous speakers have spoken to what an extraordinary year this has been, and that might be the understatement of the morning. As you can see, this year, our annual general meeting looks very different from previous years. Like many other organizations, we're holding it virtually and maintaining physical distancing in accordance with advice from the Chief Medical Officer of Health. COVID-19, the pandemic, has certainly resulted in significant changes to the way we live and work and play, and across the globe, but not only across the globe, but certainly here at home. The unusualness of this year and the development of a new approach for this event even delayed us a few days in the promotion of our AGM, but I'm pleased to see so many of you were able to join us in this particular way. This past year marked the completion of the third and final year of our 2017-2020 strategic plan, lighting the way, navigating together. It is my pleasure to provide you with a report of our performance over the last fiscal year and to speak to how Eastern Health is pursuing excellence in our planning and day-to-day work in all of our programs and services across the region. I will begin by telling you about the work that we have done to improve access in care and services. Eastern Health is working diligently to reduce wait times in all areas, including mental health and addictions. In 2019-2020, more patients were seen within their access targets in each of our 3 selected mental health and addiction services. And that includes child psychiatry, adult psychiatry, and community health and addiction services. The reduction in wait times for community services was especially notable, with 65.9% of our patients being seen within their access targets in 2019-2020. That's over double the percentage of individuals that would have been seen within their access targets in the first year of our 3-year plan. Our success in this area was achieved through much work. We implemented our mental health and addictions wait time strategy. We increased offerings of walk-in clinics and same-day appointments at doorways, counseling sessions throughout the region, and established centralized intake hubs throughout the region to streamline the referral process. However, increasing access is not just about reducing wait times. It is about having the right intervention for the right client, the right time, and in the right place. In 2019-2020, we continued our efforts to decrease the alternate level of care days in acute care. Alternate level of care, or ALC, refers to patients who are in hospital even though they no longer need hospital care and really should be cared for in a more appropriate setting, such as in their homes, in assisted living, or residential care, so that the beds occupied in acute care can be available to those who need them. Although Eastern Health has seen a steady decrease in alternate care days since 2016-17, we observed a slight increase during this past fiscal year. And this increase can be largely attributed to an increased need for palliative care beds and to challenges associated with transfer to long-term care from acute care, including the increased requirements for transport during the COVID-19 pandemic. As Eastern Health moves into its next planning cycle, we will continue to place considerable focus on caring for seniors in our region and ensuring that they are provided the necessary community support program services. One of our greatest accomplishments in 2019-2020 was the implementation of multiple innovative alternative methods of delivering care. These helped us to overcome access barriers posed by COVID-19, as well as traditional barriers faced in the region, such as geographic dispersion and an increasing demand for services. Virtual technologies such as telehealth Jabber, remote patient monitoring, Zoom, and other technologies were implemented in emergency departments, in our ICUs, in acute care, in long-term care, and in the community. And these technologies allow patients to be treated in their homes or closer to home, and allow families to visit their loved ones remotely in long-term care. They also help to protect frontline staff and preserve personal protective equipment, or PPE. As many of you are aware, wait times have been a long-standing issue in the emergency room. In fact, with the introduction of COVID, we were able to add an extra physician on nights at the Health Sciences Center, ER. Over the last 5 years, we've had an upward trend of visits during the night, and we are exploring options to extend this additional resource into the future. As well, last November at the Health Sciences Center, we amended the nurse practitioner coverage. Historically, we had nurse practitioner coverage from Monday to Friday for 16 hours a day, with no coverage on the weekends. The nurse practitioner schedule was changed to reflect coverage on the weekends. We will evaluate this practice to determine the impact that it has had on wait times. This leads me into Eastern Health's next priority area, quality and safety, which is consistently woven throughout the entire organization. Eastern Health works to keep all facilities very well maintained, while regularly monitoring safety-related indicators and eliminating safety hazards, which are inherent in all healthcare environments. This includes work towards building a culture that encourages compassionate, culturally appropriate, and competent care. And if I could just take a moment in terms of the culturally appropriate care, and just to recognize today as Orange Shirt Day, in recognition of our partnership with Aboriginal communities in the province. And today is Orange Shirt Day, and some activities are occurring in Eastern Health, even as we're involved today in our AGM. It also keeps us on track to pursue excellence across all programs, and that will guide our day-to-day work and activity. One of the quality and safety objectives in our current strategic plan is to decrease employee injuries. And in 2019-2020, we implemented multiple initiatives to prevent injuries in the areas of greatest risk to our staff. And these include manual material handling, client, patient, resident aggression, slips and falls, and patient resident handling. With these efforts, the organization's rate of employee injuries per 1,000 employees decreased from 2.5 to 2.5 from a rate of 2.7 in the previous year. Eastern Health is also committed to building a culture that encourages client and family-centered care, respectful, compassionate, culturally appropriate again, and competent care that responds to the needs and values, beliefs, and preferences of clients and their family members. We are working in partnership with them to develop appropriate solutions to healthcare issues. In 2019-2020, Eastern Health received and applied valuable feedback from client experience surveys and surveys of client and family advisory councils. Notably, when our client and family advisors were asked about meaningful engagement and their satisfaction with their advisory role, 77% provided overall positive results. Eastern Health also collaborates with various partners on strategies and initiatives to improve population health and to advance health equity within the region. In 2019-2020, many of our successful initiatives involved collaborating with community partners in the planning, implementation, and evaluation of public health programs and services. We value the contribution of local community engagement in our decision-making processes, as well as their perspectives on the unique issues in the various parts of our region. Over the course of this strategic plan, Eastern Health has achieved notable successes in several of our population health indicators. And despite remaining consistent from 2018 to 2020, the organization has observed steady increases in colon cancer screening participation and breastfeeding initiative rates over the past 5 years. The organization is currently navigating the continuation of valuable quality improvement work, such as the achievement of baby-friendly hospital designation in a COVID-19 environment. Creating a healthy workplace is also a priority for Eastern Health. While striving for excellence in health care delivery, Eastern Health aims to be an employer of choice. With close to 13,000 employees, recruitment and retention, and employee and physician engagement remain at the forefront. At Eastern Health, we analyzed sick leave hours for each full-time employee receiving benefits. As in previous years, we saw a positive trend in the average employee using 148.3 hours of sick leave in this past fiscal year, a reduction from 162.8 hours in 2014-2015. That means that on average, every benefit full-time equivalent employee of Eastern Health has decreased their sick leave usage by 14.5 hours during that time. Over the last several months, our employees and physicians have been continually required to adapt to new circumstances and overcome unforeseen challenges. We acted quickly to ensure we had the necessary supports in place for the health and well-being of our workforce. Eastern Health successfully implemented several new initiatives, including rapid response teams, team check-ins and trauma debriefing, an employee and physician navigator phone line, an employee virtual assistant, and the P2P peer support program. Going forward, the organization will continue to apply the national standard for Canada for psychological health and safety in the workplace to promote mental health and prevent psychological harm in our workplace. Eastern Health serves an aging population over a large geographic area. This, coupled with increasing client numbers, patient acuity, hospital admissions, and provincial fiscal constraints, has created a challenging environment that requires innovative solutions. And that brings us to our final strategic priority, sustainability. Notably, Eastern Health has maintained minimal growth in its operating expenditures over the last several years, while increasing the health services and absorbing inflationary costs. To mitigate fiscal and public health challenges, Eastern Health has been focused on streamlining and standardizing processes, reducing duplication and eliminating waste. Despite tremendous work in these areas, the January blizzard and the COVID-19 public health emergency did impact some sustainability indicators, as you would expect. And these include the length of stay for acute care inpatients and employee overtime. The length of stay for inpatients is calculated as the total number of days a patient is in hospital over the expected number of days in comparison to similar cases across Canada. In an effort to reduce the length of stay, the organization implemented a visual management system at St. Clair's Mercy Hospital. A visual management system is an electronic tool that displays real-time information to support multidisciplinary teams in coordinating patient care and in discharge planning. And despite this work, length of stay increased slightly to 115.2 in this past fiscal year from 114.7 in 2018-2019. In 2019-2020, employee overtime also increased to 51.6 hours from 45.7 hours in 2018-2019. Yet prior to January of 2020, several of the programs with the highest overtime usage in the organization were actually on track to achieve or exceed our overtime reduction targets. This increase can largely be attributed to the overtime required to provide critical services during the weather-related state of emergency and also the COVID-19 pandemic in the final months of the fiscal year. As a health authority, our priority is to provide safe, quality care to our clients and patients and residents. During these unprecedented times, overtime has been needed in order to continue to provide the best possible care to those we serve. And I want to say thank you to the many employees and physicians and managers and leaders in our organization who have readily stepped up to provide that overtime during the crisis period that it seems that we've been in our organization since January. Eastern Health has continued to increase both monetary and material savings through the adoption of inventory management technology solutions in supply-challenged clinical areas. In 2019-2020, the implementation of the Philips inventory solution within the cardiac cath lab captured approximately $350,000 of savings in medical surgical supplies. The use of technology to manage and automate reorder of patient care supplies is becoming a standard of care in hospital environments and provides information on the cost of caring for patients. Technology solutions allow clinical staff to dedicate more time to patient care and equip departmental staff with the tools to perform supply chain functions through a managed process. In addition, we also benefit in reductions in inventory, expired products, the administrative burden on clinical resources, recall management efforts, and overall space management requirements. I would like to encourage you to learn more about our work and progress on our 2019-2020 strategic plan by reading our full annual performance report, which can be found on our website. And that's at www.easternhealth.ca/APR. At the end of the year, we will also be releasing our new strategic plan, which will help guide us towards our vision of healthy people, healthy communities over the next 3 years. And we're very excited about that. In closing, I would like to thank our dedicated and skilled team of employees, physicians, volunteers, and our board. There's no doubt that Eastern Health has faced unprecedented challenges during this fiscal year, the weather-related state of emergency, followed by the global COVID-19 pandemic and public health emergency. During this time, our workforce came together with unwavering focus and compassion, and with enthusiasm. Teams of Eastern Health employees and physicians mobilized quickly to provide education and to engage in contact tracing and also COVID-19 testing. I'm proud to say that our staff delivered an extraordinary public health response, second to none, and thank you for that. They went above and beyond to provide care to our sickest and most vulnerable patients, residents, and clients, while implementing measures throughout our buildings to facilitate physical distancing and reduce the risk of infection. This was facilitated by quick and diligent and responsive planning by staff members across all program areas. Information is continuously evolving as we learn from other jurisdictions across Canada and around the world. And with that in mind, it's important that we remain open and ready to adapt to the newest scientific evidence and the best practices available on COVID-19. We have heard time and time again that we are all in this together, and that's especially true for those of us in the health sector. I speak on behalf of the entire executive team and the board of trustees when I say that we could not be prouder of how Eastern Health's employees and physicians have stepped up to the challenges we faced in 2020. I applaud them for their efforts, and I'm confident that this level of commitment will continue into our 2020-2023 strategic plan and daily operations. It's truly an honor to be a part of this organization. Before I finish, I do want to say as well, thank you to our many partners, and Liz spoke about some of those earlier, and Ron as well, but I do want to say that as we're in this together as Eastern Health, our partners at the Department of Health and Community Services and across government, our regional health authority partners and the other 3 regional health authorities, the Newfoundland and Labrador Center for Health Information, our union, and the many professional associations that we work with, and our innovation partners that were talked about earlier. This is truly a team sport, and we're blessed at Eastern Health to have the kind of partnerships that we do, and that's a big part of the success that we have. I also want to take this opportunity to extend my gratitude to our patients and our clients and our families for their support at Eastern Health as we continue to work on your behalf. And lastly, thanks to everyone online for taking time this morning to be part of this virtual experiment with us this morning. Thank you very much for listening, and have a great day.
Thank you very much, Dave, and thank you for your leadership and dedication as well. And thank you to everybody for joining us today.